everyone, welcome back to the most blessed profession in the world, nurses, the heart of healthcare. Keep learning, keep growing. My name is Shanaz, and in this video today we are going to discuss one of the most important, challenging but interesting topic for all the medical professionals, especially the nurses working in the emergency department, ICUs, OT, and for the student nurses preparing for their exams or viva, and for those nurses who are preparing for the nursing interviews. Okay, so let's get started. But before moving ahead, a small reminder that if you're new to my channel, please subscribe my channel, and if you find the content helpful and easy, please do like and share my videos. Okay, so the important topic that we are going to discuss in this video is emergency medicines. Okay, emergency medicines, which are also known as life-saving drugs. Why they are called life-saving drugs? Because emergency medicines are those drugs which are used in patients during critical or life-threatening conditions so that the symptoms can be controlled and the life of the patient can be saved. Okay, so that's the reason they are called as life-saving medicines. Emergency medicines are found in the crash trolley, in the emergency department, in ICUs, in OTs. Okay, a well-organized emergency tray will help to save the life of a patient and also time. The main purpose of emergency medicines are to prevent the patient condition from deteriorating. See, medical emergencies are the situations of life and death. Okay, when the patient is in medical emergency, this is a situation of life and death, and emergency drugs, they play a very wonderful, crucial, and I can say a magical role in turning the situation around. Okay, they can help us to successfully manage the patient condition and increase the rate of victim survival. Okay, so emergency drugs, what they do, they control the symptoms of the patient, and they normalize the patient's vital body functions. Okay, so they are very important drugs, and as a medical professionals we must know the list. Okay, see, if you study, there are many emergency drugs. Okay, now if you study in depth each one, there are a lot of things to study. We don't have to go in depth in pharmacology. Okay, yes, if you are interested you can go ahead, it's not a problem. But to prepare for your exams and to prepare for your viva or for a nursing interview and to carry out with your routine medical practice, there are some important points about each drug that you must be aware of, you must understand, and you must remember it. Okay, so those points we are going to discuss in this video. All the important points about some of the emergency drugs. In this video we are going to discuss only 5 emergency drugs. If we take it more, it will become more lengthy. Okay, so about each drug there are few points that you must know. One is, the first point is to which drug category it belongs, if there is any other name for that drug, and to which drug category it belongs, means the drug category or the drug class or the pharmacological class. Okay, then the second thing that you must know about the drug is what it is used for, indications. Okay, and the third thing is what is the available dose, in what form it is available, and how to dilute it, whether you have to give it concentrated or diluted, in what way, what route you can give, in which condition, how you have to give it, and whether it has to be given slow or fast. Okay, these are the important points that we must know about each drug. Okay, what is the available dose and what is the dose to be given, what are the indications, and what is the drug class. If we remember at least these points, we can smoothly carry out with our practice. Okay, then we'll have about the side effects and contraindications and everything. Okay, so let us discuss some of the important points regarding the 5 important emergency medicines in this video. The first one that we are going to discuss is adrenaline. Adrenaline is also known as epinephrine. Okay, so you might have heard of these words, epinephrine and norepinephrine, fight and flight hormones which are released by the adrenal glands in our which are sitting like a cap on our kidneys. Yes, so adrenaline is also known as epinephrine, and it is the primary drug in the emergency tray. Okay, it is a highly potent drug because they are very powerful even at low doses. Fine. So what is the drug category or the drug class of epinephrine or the adrenaline? Okay, it's a neurotransmitter as well as hormone. The drug class, you can note it down if you want. Okay, drug class, adrenaline is a catecholamine. Okay, it's a catecholamine. It is a sympathomimetic agent, alpha and beta adrenergic agonist, adrenergic agent, and a cardiac stimulant. Okay, so this is the drug category or the drug class of adrenaline. It is a catecholamine, sympathomimetic agent, alpha and beta adrenergic agonist, adrenergic agent, or a cardiac stimulant. Fine. Then next is, what are the indications of adrenaline or the uses of adrenaline when it is used? The first choice of drug in cardiac arrest is adrenaline. Okay, so adrenaline is the only drug recommended by AHA, that is American Heart Association, for all arrest regardless of the cardiac rhythm. So adrenaline is used in case of cardiac arrest when the patient is having cardiac arrest. And how it is given? It is given 1 mg every 3 to 5 minutes. Okay, every 3 to 5 minutes we give 1 mg IV. Why we are giving it every 3 to 5 minutes 1 mg IV? It is because the half life of adrenaline is 2 to 3 minutes. Okay, after 2 to 3 minutes, once it is injected, after 2 to 3 minutes it is metabolized. Okay, so that's the reason we have to repeat the dose after every 3 to 5 minutes in case of cardiac arrest. Okay, cardiac arrest is the first indication of adrenaline. Then the second indication is anaphylactic shock or anaphylactic conditions. Okay, in case of severe or life-threatening allergic reactions. So adrenaline will treat life-threatening allergic reactions immediately, and it provides immediate symptom relief. Okay, and how it is given? It is given 0.3 to 0.5 mg IM. In case of anaphylactic reactions, we are giving it IM 0.3 to 0.5 mg, and in case of cardiac arrest, we give it IV 1 mg every 3 to 5 minutes. Okay, and the third indication is acute asthmatic attack. Okay, so in asthma, it works by relaxing the muscles in the airways. Okay, it is, we can say that it acts like a bronchodilator. It inhibits the bronchoconstrictor neural pathways and it acts like a bronchodilator. It is a rescue therapy in severe asthma in adults. Okay, so the three main indications and how it is given is, it is given 0.25 to 0.75 ml based on the body weight in 2 ml NS via nebulizer. Okay, so the three main indications of the drug adrenaline is, one is cardiac arrest. In cardiac arrest, it is given IV 1 mg every 3 to 5 minutes, and second is anaphylactic reaction, severe life-threatening anaphylactic reaction, where it is given as 0.3 to 0.5 mg IM. Okay, and third is in acute asthmatic attack, where it acts like a bronchodilator, and here it is given in the form of nebulization. Okay, we dilute it with NS and we give it in the form of nebulization. Fine. The available dose is, how it is available? Adrenaline is available in ampule form, 1 mg per 1 ml. Okay, it is available in ampule form, 1 mg 1 ml. Okay, so these are the important points that you have to know about adrenaline. So hope it is understood. Then the next drug that we are going to discuss is atropine. So we finished one drug with A, this is second drug with A, that is atropine. What is the drug class of atropine? It is anticholinergic agent. Anticholinergic, anti-parasympathetic drug or parasympatholytic drug, muscarinic agent, anti-sialologue and anti-vagal effect also it has, or we can also classify it as belladonna alkaloids. These are the drug category for atropine. Okay, so how many were possible you can remember. Okay, so it is an anticholinergic, anti-parasympathetic drug and parasympatholytic drug, muscarinic agent, and it is also a belladonna alkaloid. It also has anti-vagal effect. Okay, then next, what are the uses of atropine or the indications of atropine? Okay, it is used in case of bradycardia. Bradycardia, we know that it is a heart rate less than 60. Okay, the normal heart rate is 60 to 100 beats per minute, and when it is less than 60, it is bradycardia. Okay, so atropine is used in case of bradycardia. Atropine is the first line therapy for symptomatic bradycardia in the absence of, please remember, in the absence of reversible causes. Okay, it increases the heart rate. What atropine does? It increases the heart rate and it improves the atrioventricular conduction by blocking the parasympathetic influence on the heart. How it works is, it increases the heart rate. Okay. Then second, it is also used in persistent bradyarrhythmias. Okay, where the heart rate is less than 50 beats per minute. Okay, persistent bradyarrhythmias causing hypotension, altered mental status, when there are signs of shock. Okay, when there is acute heart failure. Okay, in that case we can use atropine. Okay, the first dose is 1 mg bolus IV. Okay, then we have to repeat it every 3 to 5 minutes. Maximum we can give 3 mg. Maximum 3 mg we can give. Okay, the first dose is 1 mg bolus IV and we have to repeat it every 3 to 5 minutes, and maximum we can give 3 mg atropine. Okay. Then second indication is it is also used in preoperative as a preoperative medication. Okay, before anesthesia to inhibit salivation and excessive bronchial secretions before a surgery. Okay, before taking the patient to surgery. Okay, to prevent excessive respiratory secretions. Okay, and to avoid complications during the surgery, they give atropine because it inhibits excessive salivation. Okay, then third is it is also used as an antidote. It is also used as an antidote in overdose of cholinergic drugs or mushroom poisoning. Okay, or organophosphorus poisoning or carbamate insecticides poisoning in adults. Okay, so atropine is used in bradycardia, bradyarrhythmias, preoperative medication, and also as an antidote in case of mushroom or OP or insecticides poisoning. Okay, the available dose is it is available in a form of ampule 0.6 mg per 1 ml. Okay, it is available in the form of ampule 0.6 mg 1 ml. So if you have to give 1 mg of atropine, then we have to take 1.6 ml. Okay, so how will see here it is the first dose we have to give what 1 mg bolus IV, right? So to give 1 mg, it is available as 0.6 mg per 1 ml. So that means we have to take 1.6 ml of atropine to make 1 mg of this. Okay, so this is about atropine. These are the important points that we have to know. Then the next drug that we are going to discuss is adenosine. Very interesting drug. Okay, adenosine. The drug class is, it is a class 5 antiarrhythmic agent. See, antiarrhythmic agents are of 5 categories. Okay, class 1, class 2, class 3, class 4, class 5. Fine. So adenosine is class 5 antiarrhythmic agent. Okay, and what are the uses? It is used for as a diagnostic agent, as a therapeutic agent. Okay, adenosine, it is used as a diagnostic agent and as a therapeutic agent. As a diagnostic agent, it is used in as one of the pharmaceutical agent in myocardial perfusion stress imaging study. Okay, it is one kind of test, myocardial perfusion stress imaging study, for its vasodilatory effect. Okay, it has an effect of vasodilatation. So for that it is used in this test. Okay, for a diagnostic purpose. And as a therapeutic agent, adenosine is used in SVT, that is supraventricular tachycardia, for its antiarrhythmic properties. So adenosine is having vasodilatory effect as well as antiarrhythmic properties. For vasodilatory effect, it is used in a diagnostic test that is called myocardial perfusion stress imaging study, and for its therapeutic purpose, for its antiarrhythmic property, it is used to revert SVT, that is supraventricular tachycardia. We also have a video on SVT, right, supraventricular tachycardia. Please go through it to know the details. Okay, and it is also used in pediatric SVT, because pediatric SVT, if they are not treated promptly, they can cause cardiac arrest, okay, or heart failure. I mean cardiogenic shock and heart failure. So adenosine, it is the primary drug used in the treatment of stable narrow complex SVT. Okay, adenosine is the primary drug used in the treatment of stable narrow complex SVT. Okay, so it slows, what it does, how it works is, it slows the cardiac conduction primarily through the AV node, and it interrupts the AV node or the accessory pathway in SVT and resets back to the normal sinus rhythm. See, in arrhythmias, what is our main intention is to stop the abnormal rhythm and to bring the heart back to the normal rhythm, normal sinus rhythm. So that is what it is doing here. But how adenosine is given, that it is very important to know. see how each drug is given in particular condition. It is important for us to understand and know it. Okay, so how to give adenosine is, see, to give adenosine, suppose the patient is having SVT, supraventricular tachycardia. Okay, then what you will do, first thing is you have to make sure that a large bore cannula is placed, at least 18 gauge. Okay, so we have to place an 18 gauge proximal IV cannula in the antecubital fossa. Okay, then attach a 3-way connector to it. We don't want extension, you have to connect 3-way connector. Okay, it is a small one. Okay, extension, it will take a long time for the medicine to go. No, we want connector there. So please connect 3-way connector, and then there are 2 ways, right? So at one place you will attach a syringe loaded with adenosine, and on the other side you will attach a syringe which is loaded with NS for flush. Okay, then this adenosine, it has to be given fast and rapid IV bolus. Okay, and immediately after giving it as a fast and rapid IV bolus, the limb is raised, the hand is raised above the heart level, and we have to flush it with NS so that the medicine reaches the central circulation fast, so that the medicine reaches the heart fast. Okay, why we are doing this, why we have to give it so rapid bolus, and why we have to flush it, why we are doing it? So because the adenosine, it has a rapid onset of action. It has a rapid onset of action with a very short half-life. The half-life of adenosine is less than 10 seconds. Then just imagine, the medicine has to reach within less than 10 seconds. It has to reach the heart, it has to do its action, and then it gets metabolized. Okay, so it undergoes a rapid intracellular metabolism after that. So that's the reason we are giving adenosine as a rapid IV bolus, and then immediately we flush it with NS so that the medicine reaches the central circulation. Okay, interesting, right, about adenosine. Then next is so that it reaches the heart and quickly with enough impact. Then when adenosine is given to revert the, for cardio word, to abnormal rhythm to normal rhythm, then what happens is the heart can enter into ventricular asystole for few seconds. For few seconds the heart can enter into ventricular asystole. So it is important for medical professionals to understand and to explain it to the patient that when adenosine is given, they may have a scary feeling of dying or impending doom. Okay, but it is just for few seconds, then it will fade away. Okay, it will wear off. So it is very important to explain it to the patient. That time when we have a brief period of asystole on the monitor, it looks scary for the medical professional as well as for the patient and the patient attenders. So it's important to understand that it is for a short time, it will wear off after some time. Okay, then what is the dose? The dose given is, the first dose is 6 mg. Okay, adenosine, the first dose is given as 6 mg IV rapid bolus. Then if there is no improvement, or if the rhythm does not change to normal sinus rhythm, then we give one more 12 mg. Okay, second dose. Still if there is no improvement, then one more dose of 12 mg can be given. Okay, so first dose 6 mg, then if no improvement 12 mg, then still no improvement, we can give 12 mg. Okay, so this is how adenosine is given. And the available doses, adenosine is available in the ampule form as 6 mg 2 ml. Okay, 6 mg 2 ml. So if you have to give 12 mg, that means you have to take 2 ampules to make it 12 mg 4 ml. Okay, so it has to be given rapid IV bolus through a large bore cannula and raise the limb immediately. Okay, so that we can cardio ward. These are done in case when the patient is having stable, when the patient is stable. If it is unstable, okay, then we have to go for cardio version. Okay, adenosine will not help, we have to go for cardio version. Then next drug that we are going to discuss, see in this video we are going to discuss all the drugs with A. Okay, so first we discuss A adrenaline, A atropine, A adenosine, and now A amiodarone. Okay, amiodarone, it is also known as codron. Okay, the drug class is, it is class 3 antiarrhythmic agent. Okay, benzofuran derivative, it is a class 3 antiarrhythmic agent. Now what are the uses, indications? It is used in serious life-threatening ventricular arrhythmias. Okay, so the FDA approved indication for amiodarone are recurrent ventricular fibrillation, okay, and recurrent hemodynamically unstable ventricular tachycardia. Okay, Then the next indication is cardiac arrest. In ACLS also we used it after the third shock. After the third shock we give amiodarone. We know the ACLS pathway, right? Okay, when the patient is unresponsive, we'll check for the response. Then we start with the CPR. Then we'll attach the patient to the defib. If it is shockable, we have to check for the rhythm, shockable or non-shockable. If non-shockable, we'll continue with the CPR, and if it is shockable, we'll give shock. Okay, so after the third shock, when the patient is still not having return of spontaneous circulation, we'll give amiodarone. Okay, in ACLS. So it is used in ventricular arrhythmias and in ACLS. Then next, what it does is it blocks the potassium current. Okay, how it works is it blocks the potassium current that cause repolarization of the heart muscle during the third phase of the cardiac action potential. And as a result, amiodarone, it increases the duration of the action potential as well as the effective refractory period of the cardiac cells. This is like deep pharmacodynamics if you want to understand. So in short, what we can remember is it works by relaxing the overactive heart muscles. Okay, how amiodarone works? It works by relaxing the overactive heart muscle. Then the dose in ACLS, it is given as IV or intraosseous dose. The first dose is 300 mg IV bolus. Amiodarone in arrest, it is given as 300 mg IV bolus, and second dose is 150 mg. Okay, for stable white QRS tachycardia, okay, in the first dose is 150 mg over 10 minutes. We dilute 150 mg in say 100 ml NS and we give it over 10 minutes, and then followed by the maintenance infusion of 1 mg per minute for the first 6 hours. Okay, we dilute it with dextrose. Okay, and then we start with the help of syringe pump. We'll start with the infusion 1 mg per minute for the first 6 hours. Okay, then the available dose is, it is available in the form of ampule 150 mg 3 ml. Okay, it is available in an ampule form 150 mg 3 ml. The last drug that we are going to discuss in this video is A for aminophylline. Okay, aminophylline, it's a bronchodilator. It's a bronchodilator. It is an anti-asthmatic. Okay, it helps the lungs and the airways to stay open. What it does is, aminophylline, it relaxes the smooth muscles of the bronchial airways. Okay, it relaxes the smooth muscles of the bronchial airways and the pulmonary blood vessels, making it easier for the air to get in and get out. So in this way, it increases the contraction of the diaphragm so that more air can be drawn inside. Okay, so the drug category is, it is methylxanthine bronchodilator. Aminophylline, it is composed of theophylline and ethylene diamine. Okay, it has two components, theophylline and ethylene diamine, and it is mainly used for the effect of this component, theophylline. Okay, so it is a non-selective adenosine receptor antagonist and it is a phosphodiesterase inhibitor. Okay, the most common, it is remembered as, aminophylline is remembered as bronchodilator. Okay, methylxanthine bronchodilator. Okay, and the uses, indications are, it is used in case of apnea, it is used in case of acute severe asthma, acute when there are acute exacerbation of the symptoms and reversible airway obstruction, and it is used in case of chronic lung diseases such as COPD, chronic obstructive pulmonary disease, emphysema and chronic bronchitis. Okay, what it does is, in all these conditions, it relieves bronchospasm. It relaxes the smooth muscles of the bronchial airways and the pulmonary vessels so that more air can be drawn in. In this way, aminophylline, it prevents and treats symptoms like wheezing, shortness of breath and difficulty breathing, etc. Okay, the loading dose is 5 mg per kg body weight. Okay, and maintenance dose is 0.5 mg per kg per hour, and rate should not exceed 25 mg per minute. Okay, so this is how aminophylline is used. So these are the 5 drugs. So what are the drugs that we have discussed in this video? Aminophylline, A for aminophylline, all with A. Okay, A for aminophylline, A for amiodarone, and A for adenosine. Then next, A for atropine, and then A for adrenaline. Okay, so these are the 5 drugs. Hope it was simple and easy to remember. Okay, so these are the important points that if we remember and understand, we can carry out with our practice easily. At the same time, after this, the next thing is we should learn about their side effects and contraindications also. That also will be helpful for us in our practice. Okay, so hope this video has helped you in understanding these 5 emergency medications. So guys, knowledge and skills related to medical science is a blessing, and please use it purely for a good cause. Okay, we all have to learn from each other and we all have to teach each other. Okay, knowledge is light meant to enlighten self and to others, not to store it inside. Okay, fine. Then what? Thank you so much for watching all my videos and for subscribing, and I'm expecting more and more love and subscriptions and likes from all of you. Okay, thank you so much for encouraging me. Thank you.